Your feet may be exposing secrets about your health right now. Not tomorrow. Not someday. Right now. That persistent numbness, the swelling at the end of the day, the strange color in your toenails. What if they're not random? What if they're early warning signals your body is desperately trying to send? Many serious conditions don't begin with dramatic pain or sudden collapse. They begin quietly, subtly, in places most people ignore. And the feet are often one of the first places problems show up. Circulation issues, nerve damage, even stress on vital organs. The question is, are you paying attention? In this video, you'll discover how seemingly harmless foot changes can reveal deeper health concerns, what signs you should never dismiss, and how to recognize when your body is asking for help before it's too late. Cold feet are easy to dismiss. Maybe it's the air conditioning. Maybe it's winter. Maybe you just run cold. But what if your feet feel cold even in warm environments? What if socks don't help? Your feet are the farthest points from your heart. That means they rely heavily on strong, healthy circulation. When blood flow is compromised, the body prioritizes vital organs first. The feet become secondary. Imagine a highway system where traffic slows down at the furthest exit. That's what poor circulation does. Reduced blood flow can signal peripheral artery issues, early cardiovascular strain, or even undiagnosed metabolic imbalance. Now ask yourself, do your toes turn pale or slightly bluish? Do they take longer to warm up than the rest of your body? Do you feel tingling along with that cold sensation? Sometimes, people notice this years before a formal diagnosis of heart or vascular problems. The body whispers long before it screams. And here's something many overlook: stress plays a role. Chronic stress causes blood vessels to constrict. Over time, that tension affects circulation patterns. Take a moment. Gently press on the tip of your big toe until it turns pale, then release. Does the color return quickly? Or does it linger? That tiny delay can tell a story about how efficiently blood is moving through your system. Your feet might not just be cold. They might be asking for better circulation, better movement, better care. Have you ever noticed your feet feeling colder than everyone else's around you? There's a particular kind of sensation people often ignore. It feels like pins and needles, a subtle buzzing, a light electric current under the skin. It comes and goes. At first, it's easy to blame posture. Maybe you crossed your legs too long. Maybe you slept in an odd position. But when numbness or tingling becomes frequent, especially in the toes or soles, it can signal something much deeper. Your feet contain thousands of nerve endings. They're incredibly sensitive. When those nerves stop communicating clearly with your brain, it's rarely random. One of the most common causes? Blood sugar imbalance. Long before someone is officially diagnosed with diabetes, the small nerves in the feet often show stress. The damage can begin silently. But blood sugar isn't the only factor. Vitamin deficiencies, especially B12, can slowly damage nerve tissue. B12 plays a crucial role in maintaining the protective covering around nerves. Without enough of it, signals become distorted. That's when tingling starts. Now pause and think. Do you ever feel numbness at night? Do your feet feel thick, like you're walking on padding? Have you stumbled slightly without knowing why? Those subtle coordination changes can point to early nerve dysfunction. Here's the unsettling truth. Nerve damage is easier to prevent than to reverse. The earlier you recognize it, the better your chances of protecting long-term mobility. Your feet may be whispering that your nerves need support. The question is, are you listening? At the end of a long day, mild swelling can feel normal. You stood too long. You walked too much. Gravity did its job. But what if your feet swell even when you haven't overexerted yourself? What if your socks leave deep marks? What if pressing your finger into your ankle leaves an indentation that stays for several seconds? That's called pitting edema. And it's not just about fatigue. Swelling happens when fluid accumulates in tissues. Your body constantly balances fluid levels through your heart, kidneys, and lymphatic system. When that balance is disrupted, your feet are often the first place it shows. Persistent swelling can be linked to heart strain. When the heart doesn't pump efficiently, fluid can pool in the lower extremities. It can also point to kidney dysfunction. The kidneys regulate fluid and sodium levels. When they're not filtering properly, the body retains excess fluid. Liver issues may also contribute. The liver produces proteins that help keep fluid inside blood vessels. When those proteins drop, fluid leaks into surrounding tissues. Ask yourself, is the swelling worse at night? Does it affect both feet equally? Do you feel short of breath along with it? Swelling is not just a cosmetic issue. It's often a signal of internal imbalance. Your feet may be revealing how well your body is managing circulation and fluid control. Have you ever noticed your feet feel unusually cold, even in a warm room? You touch them, and they feel icy compared to the rest of your body. You put on socks, but the chill doesn't fully go away. This isn't always about the weather. Your feet are the farthest point from your heart. That means they depend heavily on strong circulation. When blood flow weakens, the first place to feel it is often the toes. Poor circulation can result from narrowed arteries. Over time, plaque buildup restricts blood flow, a condition known as peripheral artery disease. When oxygen-rich blood can't reach your extremities efficiently, coldness becomes persistent. Sometimes the skin may look pale or slightly bluish. In more advanced cases, wounds heal slowly. But circulation isn't the only factor. Thyroid dysfunction can also affect temperature regulation. A slow thyroid lowers metabolic activity, making you feel cold more easily, especially in hands and feet. Now reflect. Do your feet feel colder than your hands? Do they change color? Do you experience cramping in your calves when walking? Your body prioritizes vital organs when circulation is compromised. The feet are often sacrificed first. Cold feet can be more than discomfort. They can be a warning about blood flow and vascular health. Have you ever felt that pins and needles sensation in your feet, even when you haven't been sitting in an awkward position? Maybe it starts as mild tingling, a light buzzing, a subtle numbness in the toes. Over time, it becomes more frequent, more intense, sometimes even painful. This sensation often points to nerve involvement. One of the most common causes is peripheral neuropathy, a condition where nerves become damaged and stop sending signals properly. And one of the leading causes of nerve damage worldwide is diabetes. When blood sugar remains elevated for long periods, it slowly injures the small blood vessels that feed the nerves. The damage begins silently. The feet are usually the first area affected. You may notice burning sensations at night, reduced sensitivity to temperature, difficulty feeling small injuries, a feeling like you're wearing invisible socks. Vitamin deficiencies, especially B12, can also contribute to nerve symptoms. So can chronic alcohol use or certain medications. The danger is this: numbness can prevent you from noticing cuts, blisters, or infections. Small wounds can worsen quickly without proper sensation. Your nerves are your body's communication system. When they whisper through tingling, they're asking for attention. Your toenails grow slowly, quietly, almost unnoticed. But when they change, they often reflect something deeper happening inside your body. Have you noticed thickened nails? Yellowing? Brittle edges that crumble easily? While fungal infections are common, persistent nail changes can sometimes indicate circulation issues. Poor blood flow reduces oxygen and nutrient delivery to the nail bed, affecting growth and appearance. Slow-growing or unusually pale nails may suggest anemia. When your blood lacks sufficient healthy red blood cells, oxygen delivery decreases, and your extremities show it first. If nails become spoon-shaped or concave, that can also point toward iron deficiency. Clubbing, when the nail curves significantly around the fingertip or toe, can be associated with chronic lung or heart conditions. Your nails are made of keratin, but their health depends on your internal balance. Ask yourself, Are your toenails changing shape? Growing slower than before? Becoming more fragile? Small visual changes can be early signals. Your body often gives subtle clues long before major symptoms appear. Your feet don't just carry your weight, they carry information. Foot pain makes sense after a long hike. It makes sense after new shoes. It makes sense after an injury. But what about pain that appears without a clear cause? A dull ache in the arch, a sharp sensation in the heel, burning along the sole. When pain shows up without trauma, your body may be signaling inflammation. Conditions like gout can cause sudden, intense pain, often starting in the big toe. Uric acid crystals accumulate in the joint, triggering swelling and sensitivity that can feel unbearable overnight. Arthritis can also begin subtly in the small joints of the feet. Morning stiffness that improves with movement is one clue. Sometimes, unexplained foot pain links back to circulation or nerve involvement. Poor blood flow deprives tissues of oxygen. Damaged nerves misfire and send pain signals even without injury. Consider this. Does the pain worsen at night? Does it wake you up? Is it symmetrical in both feet? Pain without injury is rarely random. It's information. Your feet absorb your body weight every day. When they begin to hurt without explanation, they may be revealing stress happening far beyond the soles. If your feet have been sending signals, coldness, swelling, tingling, nail changes, unexplained pain, how long will you keep calling them normal before you decide to truly listen? Look closely at the skin on your feet. Not casually, intentionally. Is it excessively dry even when you moisturize? Are there cracks in your heels that never fully heal? Is the skin thinner, shinier, or unusually tight? Skin is often the first visible surface where internal imbalance shows up. When circulation declines, the skin may appear pale or glossy because it isn't receiving adequate oxygen. Hair growth on the toes may decrease. Small cuts may take longer to close. Persistent dryness can sometimes point toward thyroid imbalance. A sluggish thyroid slows metabolism, reducing oil production in the skin. The result? Rough texture, flaking, cracking. Darkened patches around the ankles may indicate circulation or metabolic issues. Recurrent fungal infections can suggest immune system stress or elevated blood sugar. Now pause and think. Have you noticed wounds healing more slowly than before? Do minor cracks turn into stubborn sores? The feet endure pressure every day. But when the skin itself begins to change in texture, color, or resilience, that's not just cosmetic. It's biological feedback. Your body constantly communicates through small signals. And sometimes, the quietest changes carry the most important messages.